Hello, this is Brian, inventor of the MAT table, multiple applications treatment table. We're going to go over tilt table functions and safety with tilt table functions. The MAT table was designed to be a tilt table with or without straps. So if you have a burn patient or a patient with skin integrity issues, you can utilize it without the straps. And it goes up to 45 degrees as a maximum, which is 88% body weight. And in that case, as long as you're with the patient, if they pass out or anything, you can control them while you lower them back down. There's two braking systems to be used, whether you choose to use the safety belts or not. The first braking system is the flection stop. This brake is designed to help the patient get on and off the table. And generally, you only need one of the two brakes on if it's under 15 degrees or for the patient getting on and off the table. But if you do the tilt table function utilizing this horizontal brake, it's important if you're over 15 degrees to use both brakes. There's one on both sides. There's an additional way to brake, and it's preferred than the flexion stop, which is right here. You cinch this up all the way. When the patient has their legs straight, this will stop the sled from moving. The advantage to this is at higher elevations, when you're after doing tilt table function, you can loosen this a little bit as you go down and let them do some exercise. When you use the horizontal brakes, they can bind when you're over 15 degrees, and then it's hard to unbrake. You have to lower the table all the way back down. So there are many different safety straps. This safety strap attaches here, and it's like a seat belt. The most commonly used one is right over here. It's the knee strap, and this can be applied while the patient has already been on the table. You keep these in place, and they're on the table. This goes over their knees, and here you generally have to use a bolster. And then when they're done with their tilt table functions, you can take this off and go immediately into squats without having to change any other things or get them on and off the table. Thank you.